Welcome back to Wellness Lenses, where every conversation is a deep dive into mental wellness. In this video, we'll try to figure out what the words sociopath and psychopath really mean, as well as how we often use these words incorrectly. You'll be able to tell the difference between the two by the end of this video, and you'll also learn more about yourself. If this is something that appeals to you, please consider subscribing to our channel for more content on mental health and psychology. Now, let's start with a thought that has probably crossed your mind. Could you be a sociopath or a psychopath? Perhaps a little self-reflection is mixed in with the curiosity of the topic. We're about to go on a trip that will make things clear, dispel myths, and empower you with knowledge. So don't worry. Now, when we untangle the complicated threads of sociopathy and psychopathy, it is important to understand the nuances that set these terms apart. Both sociopathy and psychopathy fall under the umbrella of antisocial personality disorder, or ASPD, at their core. But there are subtle distinctions between their developmental origins and behavioral manifestations. With roots in adverse childhood experiences or a turbulent upbringing, sociopathy is often thought to be more environmentally influenced. A manifestation of antisocial behaviors as a sociopath may have been experienced by those who have been labeled as sociopaths as a result of trauma. On the other hand, a stronger genetic component is thought to be present in sociopathy. Psychopathic traits are thought to be more innate and possibly hereditary when certain genetic predispositions are present. A charming and calculated demeanor is a common trait of psychopaths, which can be seen in their behavioral landscape. Lack of remorse or guilt frequently goes hand in hand with their capacity to manipulate and deceive others. A more impulsive and erratic pattern of behavior may be displayed by sociopaths. On the other hand, their actions are often influenced by a volatile combination of emotional responses and a disregard for societal norms. Understanding these distinctions isn't about putting people into boxes. It's about showing how complex human behavior really is. Recognizing that mental health is a complex balancing act of genetics, environment, and individual experiences. It's important to approach the subject with empathy and an open mind as we continue our investigation. Now that we've touched the surface, let's dive into the complex world of key characteristics that define sociopath and psychopath. As I've mentioned, both have a profound lack of empathy, which is their main point of connection. Distinctions between the two are made by the nuances present in this lack of empathy, however. Psychopaths frequently display a superficial understanding of emotions due to their calculated and charming demeanor. They can navigate social situations with ease thanks to their uncanny ability to mimic emotions. Sociopaths, on the other hand, may struggle with a more sporadic and intense display of emotions, which makes their interactions unpredictable. Another commonality is manipulation. Though there are different methods, psychopaths often manipulate with a cool, detached finesse, preying on other people's vulnerabilities. Sociopaths may use more overt and confrontational methods to accomplish their objectives because of their impulsive nature. The disregard for societal norms is a trait that many people share, but the manifestation is different. Psychopaths hide behind a facade of normalcy and blend into society with ease. A more chaotic and rebellious lifestyle may result from sociopaths' difficulty conforming. Exploring these traits isn't meant to sensationalize or stigmatize people. Rather, it's meant to foster understanding of the complexities within the antisocial personality disorder spectrum. Keep in mind that these traits exist on a continuum, and the interaction between genetic predispositions and environmental factors contributes to the variety of their expression. When examining the origins of sociopath and psychopath, the age-old argument of nature versus nurture takes on new significance. These disorders, which are part of the larger category of antisocial personality disorder, frequently make us curious about how genetics and environment interact. The hereditary aspects of psychopathy, which is often thought to have a stronger genetic foundation, raise interesting questions. The importance of nature in shaping these behavioral traits is highlighted by research studies like those by Moffitt, which suggest that certain genetic predispositions can contribute to the emergence of psychopathic traits. On the other hand, sociopathy is frequently linked to environmental factors, especially adverse childhood experiences and a tumultuous upbringing. Nature and nurture rarely interact in isolation, so it's important to understand how they work together. Recent research studies suggest that the interaction of genetic predispositions and environmental factors can increase the risk of developing antisocial traits. This emphasizes the need for a holistic understanding of sociopathy and psychopathy, acknowledging that the causes of these disorders are not binary, but rather a dynamic intermingling of genetic and environmental factors. Understanding sociopathy and psychopathy also requires a deep understanding of the mysterious structure of the brain. A fascinating aspect of the disorders has been revealed by neurological research on structural and functional differences within the brains of people with these traits. Studies, like the ones done by Yang and Rain, have shown that people with psychopathy have differences in parts of the brain that are responsible for empathy and impulse control. Reduced gray matter in these regions suggests that the diminished emotional response and impaired decision-making that are typical of psychopaths have a neurological basis. The neurological underpinnings of psychopathy during moral decision-making tasks have also been uncovered by functional magnetic resonance imaging studies. A dynamic perspective on how neurobiology affects behavior is provided by these findings, which highlight the fact that aberrations in brain function go beyond a static structural model. The neurological landscape is just as interesting when we talk about sociopathy. Early studies suggest that disruptions in the emotional processing areas of the brain contribute to the impulsive and emotionally charged behavior that is hallmark of sociopathy. Research is still ongoing. This neurological lens shows how genetics and brain development work together in a complex way. It gives us a look at how nature and nurture interact in the neural pathways. As we continue our investigation, remember that these results are not an excuse for behavior, but rather a lens through which we can deepen our understanding and foster empathy for people who are dealing with these conditions. Understanding the behavioral patterns linked to sociopathy and psychopathy reveals a rich tapestry of complexities as we make our way through the maze of antisocial personality disorder. Psychopaths, who are often portrayed as charming and manipulative, display behaviors that are deeply rooted in their distinctive cognitive makeup. A consistent lack of remorse or guilt goes along with their ability to navigate social scenarios with finesse. Studies have outlined key traits such as superficial charm, a grandiose sense of self-worth, and a need for stimulation, which contribute to the unique behavioral signature of psychopaths. The manifestation of sociopathy, on the other hand, is more turbulent and unpredictable. Sociopaths may struggle with emotional instability, impulsivity, and the ability to conform to societal norms. Their actions are less calculated than those of their psychopathic counterparts because the outbursts of anger or aggression that define their behavior frequently result from a volatile blend of emotions. Given the complexity of antisocial personality disorder, diagnosing and treating sociopathy and psychopathy needs a nuanced approach. First and foremost, it is important to stress that only qualified mental health professionals are able to accurately diagnose these conditions. A comprehensive evaluation of behavioral patterns, emotional responses, and a thorough examination of a person's life history are common components of clinical assessments. The Psychopathy Checklist Revised, a widely used instrument, is one tool that is frequently used in psychopath diagnosis, and I have a video about this test in my psychopathy playlist linked below. Clinicians can gain a deeper understanding of a person's mental health by using this tool, which evaluates key psychopathic traits. Evaluation of the effects of sociopathic stressors, childhood trauma, and impulsive behaviors may be part of the diagnostic process for sociopathy. Understanding the socio-cultural context that might have influenced the emergence of antisocial traits is frequently the emphasis. Due to the innate nature of these disorders, treatment approaches for sociopathy and psychopathy are difficult. Interventions seek to control and mitigate harmful behaviors, even though there is no cure. Cognitive behavioral therapy has worked for some people, especially when it comes to dealing with certain traits that are linked to these disorders. Research has shown the potential advantages of cognitive behavioral therapy for reducing recidivism and promoting pro-social behaviors in people with psychopathic traits. Recognizing that change is gradual and a complex process, it's crucial to approach treatment with realistic expectations. Additionally, the rehabilitation process is greatly aided by the presence of support systems, such as family and community resources. As we come to the end of this enlightening journey, please remember that understanding these terms isn't about labeling ourselves. It's about helping to foster empathy and compassion. We can build a more compassionate and knowledgeable society by being aware of these nuances. Thanks for being here today. If you found valuable information in this video, please give it a like, share it with your loved ones, and don't forget to subscribe. See you in the next video.